that means, right? Don't sit down. Everybody come stand up. Everybody come stand up. Good. Come on up. Come on up. Come on up. All right, arms up. Just up on your tippy toes. If you can't jump, it's okay. Let's get some blood going. Turn to your neighbor and say, "I'm Florida champion." Woohoo! All right. Good job. Good job. Excellent. Good to see you guys. You're among friends. All right. Welcome, everyone. Just going to get a little bit more room here. Yeah. Okay. Should be better. Good. Happy Tuesday. And what are you guys here for tonight? What would you like to learn about? We want to learn about getting healthier. Where does health come from? How to get it when you need it? How to get the most out of your care here while you're a patient? How many of you guys want to have the best results? Say aye. Aye. How many of you guys want the results to be permanent? Double aye. Yes. Okay. So tonight's going to be good. You're going to get that. You're going to learn some important things about your immune system. You're going to learn some important things about how to stay as healthy as possible as long as possible. So tonight we have titanium immune system, but if you haven't received one of these workshop cards, you can see the next one next month is heart health. The month after that, we got cancer prevention, diabetes after that. So, keep learning, keep growing. Because when you stop learning and you stop growing, you start what? Dying. Good, you guys know it. Sobering thought. But we'll just keep learning and keep growing. So thank you for being here tonight. How many of you guys have been to a workshop before? Keep your hands up if you've been to 2 or more workshops. 3 or more? 4? 5? Keep your hands up if you've been to 10 or more workshops. 20? 50? Got 100? All right, we got the 100 club right there. But give yourselves a round of applause. I'm proud of all of you. Good, good. And if it's your first time, congratulations. Okay, so turn this thing on and we will get going. All right. So talking about your immune health, what's the number one factor affecting your immune health? What's the number one factor when it comes to your immune system that will impair your ability to stay well? Let's throw some things out there. Chronic stress, will that weaken your immune system? Yeah, you betcha. Too little exercise, not enough movement. Also too much exercise. Yeah. How about poor diet? Can nutrition be a factor? Yes. Mm-hmm. Yeah, we're going to talk about that. Gut imbalance. Last workshop, if you were here last month, we talked about the microbiome, how that plays a critical part in your immune system too. Sleep deprivation. Is sleep important? Yeah, you can really wear your immune system down if you don't get enough sleep. Toxicity, poor hygiene. How about lack of medication? Like if you don't have enough medication in your body. How many of you guys take no prescription drugs? Can I see a show of hands here? There's a few of you. Good. Okay. Do you think if you're healthy and you're not on prescription medication, should you start taking a whole bunch maybe tomorrow or next week, or maybe start lining up for some novel vaccines that you see on the 6 o'clock news? No. So there's certainly different things that actually go into the recipe there. It's a silly question, but I am going to make a point of this because your body's not stupid, it's smart. And if your body can heal when there's a broken bone or there's a cut and the skin heals up, then certainly your body's not stupid, it's smart. It knows how to heal. So God doesn't make junk. If we're fearfully and wonderfully created in His image, did He forget to put anything inside of us? Right? Or was anybody born with a little bottle of Tylenol sit right here, so when you get a headache you just tap it and like one pops in? No, like we have everything that we need. God doesn't make junk. We're perfect. And there is a time when we need prescription medication, drugs, surgeries. There's a time and a place for that. But unfortunately, in our culture, we're all too quick to jump for that without giving your body a chance to heal. Fair enough? Okay. So when you look at that picture, what do you see? What do you see in that picture there? What do you see? You see the typical commercials, the typical advertisements that you're being bombarded with, which are teaching you that if you don't ask your doctor for this, you could be in trouble. Like if you're not getting this medication that they're advertising for, you could die. And if you don't catch it fast enough, you're at risk. So all this propaganda really that we see on advertising on TV with all these drugs, all these commercials, It's based on fear. It's all based on fear. And the United States is only one of 2 countries on the planet where they're actually able to advertise legally to you prescription or over-the-counter medication. Did you know that? So we're one of 2 countries. And do you think that influences the way that you think? You better believe it. Yeah, we're being brainwashed. Whether you like it or not, whether you're aware of it or not, you wind up, thinking like everybody else, when there's an ill, there must be a pill, right? If I have a symptom, if I have a problem, then maybe I need to go to the doctor and take something and get something. And, well, if it's an emergency, that may be the case. But if it's not, it very well may not be the case. And I want to show you where I'm going with this. We're 4% of the world's population in the United States, but we account for half of all prescription drug spending. Did you know that? If that was the case, if more prescription drugs and spending more on healthcare equated to better health, we'd be the healthiest country on the planet. But you know what? Are we? Far from that. Far from it. We're at the bottom of the totem pole when it comes to ranking the United States with all these other industrialized nations. We're at the bottom of the barrel. We may live longer, but our quality of life is horrible. We take more prescription drugs as seniors than any other country relative in the world. We have the worst health outcomes, and we spend more money on health care and more money on prescription drugs than any other country. And so we spent $487 billion on drugs last year. Much of Big Pharma's budget is spent on what? Marketing, which is teaching you what you should do about your health. So, think about it, What is all this about?
Money.
Yeah, what is it? It's not about your health, It's about profit. It's about the people who invest in Big Pharma, people who put their money in stocks, and they want their stocks to go up, and of course they're going to want to invest in that and all the things that come with that. Great, but really the number one factor negatively affecting your health comes from all of this. So certainly stress, lack of sleep, poor nutrition, all those things are factors negatively affecting your health. But the way I see it, based on the big picture from a 30,000-foot aerial view with what's happening here, the number one factor negatively affecting your health is poor thinking. Poor thinking, right? Just going along like sheep with what everybody else does. Well, it's COVID. May as well line up. Everybody else is getting their shot. Ooh, sorry, I don't want to step on any toes. But you know what? I'm not sugarcoating it tonight. I'm going to tell it like it is, and you can take it with a grain of salt, or you can throw it out the window. Whatever you want to do with it. But the reality is that if the sheep are going this way and they're going toward a cliff, do you want to go over with them? No. If you do what everybody else does, what do you think you get? What everybody else gets. As you get older, you go to more doctors, you take more medications, if you keep doing what everybody else does. And I'm just going to keep beating this dead horse, this dead pony, until I see everybody making better decisions. It takes time, but the more you understand concepts as far as where your health comes from and how to get it when you need it, it's a long road. It may be longer for some of you than others, but I'm going to start dipping you in this now so that you can start thinking better. If you think better, you will make better decisions. Right or right? Yes. Not just blindly trusting what your family or friends do. Not just blindly trusting what your doctor says is right for you. Just because they have a degree and they're very knowledgeable, it doesn't mean what they're doing for you is getting you healthy. There's a difference between health and our medical system, right? Taking medications, getting vaccinated, doing what's on the medical standard of care does not necessarily equate to getting healthy. You got that? Yeah. That's important that you understand that, because that will help you be patient before you rush to fulfill that prescription, or before you go ahead and run and do what they tell you to do. It's one thing to get tests, to get an MRI, to get a blood test. It's another thing to follow through with treatments that could be leaving you in worse shape than if you did nothing at all. And again, I know there's a time and a place for some of these things, but you have to be patient. What does the Bible say? Be still. Be still and know that I am God. Right? Be still. Patient. So we pray on these things and we also think for ourselves. Because who's responsible for your health? Your friends, your family, your doctor. Who's responsible for your health? You are. So you have to deal with the consequences also. So you can't outsource that to anybody. We have to think better. Johns Hopkins School of Medicine, they wrote up this thing, and here's what they said. Fevers actually what? Fight bacteria and viruses. Fevers fight bacteria and viruses. If you let your fever go over 104, diseases are shortened by letting the fever run its course. Why? Because bacteria and viruses cannot survive in elevated body temperatures. Did you know that? So why in the world do they tell you to take the fever down? Wow, that doesn't make sense, does it? You know, we raised 3 boys. They're older now, but when they were kids and they had fevers, I never tried to take the fever down. I always bundled them up because I learned what you're seeing right there. I learned that when I was in chiropractic school. I learned that from the same medical textbooks they teach in at Harvard or any of these other medical schools. You know, the body's not stupid. It is smart. So let the fever run its course. Sniffles, sneezes, and fever are what? They're good for you. They clear the airways of harmful irritants, right? Coughing rids the body of bacteria and viruses by way of the lungs if you take drugs. Or cough suppressants. What are you doing? You're shoving it back down. Your body's trying to get rid of it, right? Yes, I know sometimes people make the decision to take it for relief because they don't like the symptoms. It's uncomfortable. And I understand that. I've been there. But then I think, you know, this stinks. I feel horrible. I feel like a truck ran over me. But I know my body's doing something important. And I don't want to get in the way. Do you? Right? Preventing symptoms from expressing themselves may set up for reinfection or what? More serious disease. If your immune system's trying to work and do its job, and you shut it down, are you going to outsmart the intelligence that God put in your body? It's going to come back with a vengeance, and it will resurface somewhere, somehow, someday, in some way. And a lot worse than a cold flu or coughing, right? Because that's your immune system. And how does cancer get a foothold in your body? With a weak what? Immune system. Is all this making sense? Okay, so the symptoms are the what? Yeah. When we start suppressing these things, we're stopping our body from healing itself. Great, you know? I mean, we can open up our medicine chest and pop these things, but it's at the expense of long-term health. Does that make sense? So what's the standard of care in our country? Medically speaking, it's to control symptoms. Go to the doctor. If you have an infection, you get an antibiotic. If you have pain, you're getting pain relievers. If you have a head cold, they're going to give you something to what? To shut off the pain. But that's not the same as getting healthy. And that's the whole point I'm trying to make here, that we need to continuously reinforce, because when you leave this office, guess what? Your thinking defaults back to the way you were raised and what everybody else is doing, what everybody else is talking about it at school or work or church, right? And you're the salmon swimming upstream, and you're like, maybe it is easier to go in the same direction that they're going. Bah! Turn to your neighbor and say, bah! What does that sound like? Sheep. We're not sheep. No, we were born for better things. Don't you agree? Vaccine facts. This comes from American Journal of Infection Control, The Lancet, prominent medical journals. They've written about this. Many experts disagree that vaccines help wipe out childhood diseases. What? The largest historical decrease in deaths caused by infectious disease was not from the modern antibiotic or vaccine era, but from the introduction of what? Clean water and effective sewer systems. Now, some of you guys are not aware of this, but a lot of these death rates from these diseases, like the measles and pertussis, they were already on the decline before the advent of vaccines. Did you know that? If you look here on the left, here's the measles. Between 1915 and 1958, it already declined 98% before the vaccine was released. Did you know that? There's the pertussis from 1900 to 35, declined 80% before the vaccine was released. Did you know that? Yeah. Think about it. I mean, we just went through COVID not too long ago. What happened with the Spanish flu? Did they have a vaccine for that? I mean, millions and millions of people died, right? But eventually, what happened? It all declined because people developed immunity to it. So this is just something for your knowledge. That's, these vaccines are not necessarily the messianic or, the great salvation that we have been brought up to believe. And if you do your research, you may find otherwise. So this is just an example of why I chose not to have my children vaccinated. You may know some other people and parents, especially nowadays, with a lot that you're seeing on the news and why President Trump appointed Kennedy to this, because the research is out, but it's been suppressed for a really long time. I've known about it, and that's why, I'm sharing some of these things with you guys. Some of you are older, you don't have children anymore, but you have grandchildren, and you have knowledge, and with knowledge comes responsibility, right? Because what I'm sharing with you could be the difference between life and death for a young child who has a genetic predisposition to autism or to mental retardation when they get exposed to this. Not every child that gets a vaccine develops brain damage or a life-altering change after. It doesn't happen all the time, but when it happens to your child, the risks are 100%, right? It's like Russian roulette. I didn't want to take that chance with my kids. That's why they weren't vaccinated. And you know what? Perfectly healthy today. And they got sick a lot less often than most kids did. Never had to take them to the pediatrician once, and they never had a prescription or over-the-counter drug in their body. Ever. Even to this day. So, children are at great risk for damage due to heavy metal and other toxic ingredients in vaccines. The total number of shots also has crept up as the years have gone on. How many of you guys were vaccinated? I was vaccinated. In 1969, I got maybe a half a dozen vaccines. Some of you got like 2, right? What are they up to now? These days, the schedule, close to 80, some beyond, right? I mean, it's hard to wrap your mind around this, but a lot of the danger also is multiplied not just by the number of vaccines that they're given, but when they're given in combination. Like measles, mumps, and rubella, MMR, DPT. So when they have the trivalent vaccines, a lot of times that is a huge irritant, highly toxic to the nervous system, and it throws it into shock, and that's where a lot of these kids really devolve, and they stop developing. Autism been related to this, and they stop developing their ability to speak. Some of them have serious brain damage, mental retardation. Usually it's tied back to these trivalent vaccines. I'm not particularly thrilled with getting any of them because of the ingredients. If you don't know what's in a vaccine, aluminum, which has a connection to Alzheimer's disease, mercury. Many of the same symptoms that they find with mercury toxicity are the same symptoms that they find with autism. Did you know that? Formaldehyde, which is what they embalm dead people with, highly toxic. Human and animal cells, which is a good enough reason for a religious exemption. If you didn't want your child vaccinated or a grandchild, you could go to HRS and get them out based on religious exemption, because it seems somewhat unethical to put aborted fetal tissue, pig blood, horse blood, dog cow, kidney cow, chick embryo, chicken egg, all these forms of living things in a human body. Highly toxic, MSG. So at any rate, I wanted to share some of this with you because it's important. And it's not just with childhood vaccines. Many of those same ingredients are in flu shots. And you want to keep that in mind next time you make an informed or an educated decision about what kind of consequences may be involved with that. This is informed consent. So a lot of parents say, well, kids can't go to school if they don't have their shots, public school. And it's not true. So early on, my oldest son went over here to Central Park, and we brought one of these informed consents in from DH 681. It's a religious exemption form. Any child can avoid vaccines if the parents wanted them to and still attend public schools. So just if anybody needs that, at least you know. You also have a handout. In your handout, there's some other resources that you can follow up with, and if you wanted to get more information with any of that also. So I don't want to go too more into that, but again, you have to weigh out the short-term benefits with the long-term consequences. Repeated vaccination at any age increases the risk of repeated infection, in addition to other chronic health problems. Getting the infection naturally appears to strengthen the immune system and decreases the risk of reinfection. Why? One of the main differences between the immunity that you get from vaccines and natural immunity is that when you get the infection naturally and your body develops the white blood cells and the immunity to it naturally, you have it for the rest of your life. But with vaccines, that's not the case. You always have to keep going for boosters, right? You guys know that, right? So it's artificial, and obviously it's, this is one of the considerations that we took into account before we made that decision for our children, and also for myself as well. Even a couple of years ago, when we had COVID, I had to make that decision based on this. And I know I got COVID, but I didn't want to risk getting it again, right? And even worse symptoms. And if you look at one of the studies that have come out, a lot of studies are coming out now. Here's one of them, a German study comparing between people who got the COVID shot, and those who didn't. And what did they find? In 2022, the COVID jabbed, you guys know what that is, the people who got the shot, they were 18% more likely to get COVID than the unjabbed. So they didn't have COVID, they got the vaccine, and they were more likely to get it. And their infections were more severe. The jabbed also reported being diagnosed with new chronic health problems at a rate of 2.5 times higher than the unjabbed. And I know this to be true. I've seen it. I've seen it in some of my patients. I've seen it in some of my family members. So half my family are very naturally oriented and natural minded, don't like taking medications, don't like going to doctors. The other half, they love doctors. They love taking medications. They love getting, all their vaccines. And they're diehards. And they've gotten COVID like 3, 4, 5 times. And they've been vaccinated 3 or 4 or 5 times. So what I'm sharing with you here is, from what I've seen, very consistent. Not a good deal. Not a good deal. Okay. So again, what I'm trying to reinforce here is that the number one thing that keeps setting you back, that keeps you from getting to your best, and keeps you, as you get older, you want to get healthier, right? Right? As you get older, you want to get healthier. Is everybody in agreement with that? Yeah. So if the number one thing is our thinking and our decisions, then what do we have to do? We have to make better decisions. We have to get to the cause. All right? If you're sick, there's got to be a cause to it. Right? If you have a sinus infection, there's got to be a cause to it. If you have an ear infection, there's got to be a cause to it. If you have diabetes, there's got to be a cause, right? If you have cancer, there's got to be a cause. Does that make sense? All right? But if you're healthy, there has to be a cause. Whoa! Wait a second. Whoa. Are you healthy right now? If you're healthy, there's got to be a reason. There's got to be a cause. And if there is a cause, and you know what that cause is, that source is, do you ever want to unplug from that? Heck no. Heck no, right? Okay, so I'm going to drop this on you. What do you see there? You see a dirty garbage can, right? You see a dirty garbage can, it's filled with garbage, and if you leave the garbage there long enough, what do you start seeing? Friends, flies, roaches, maggots. Why? Because you've given them the opportunity. If you leave that food out, if you leave that garbage out, you're inviting that. Because it's a ripe host, it's a ripe environment for them to feed on. So, what's the cause for the flies? The garbage. Thank you. So, if you just take a can of Raid or insecticide and you just kill the flies and you kill the roaches, but you leave the garbage there, have you corrected the cause? No. How do you correct the cause? Get the garbage out, right? Okay. Where are you going with this, Dr. Yachter? Well, same thing in your body. If you have infections, bacteria, viruses, those are like the flies and the roaches. The bacteria are always there, But they will not bother you and start feeding on you unless you are a wonderful host. How do you become a wonderful host? By running your immune system down. By running your nervous system down. Lack of sleep, toxins, subluxation, all those things that we talked about, right? And you don't feel it while you're going down, but those viruses and bacteria, they're in there. They're like, woohoo! Call out the party! It's happening, it's on! And then you wake up one day and you're like, oh my gosh, I got a knife going through my head. And where do we go? We go to the doctor. And what does the doctor give us? Prescription. Antibiotic. Spraying the flies, spraying the roaches. Does that correct the cause? What's the cause why you got the infection? Right? The garbage. So disease is not a thing to be conquered. It's not something to be killed. You're just treating the effects. It's a condition. Disease is a condition. Cancer is a condition. Heart disease is a condition. Diabetes is a condition. An ear infection is a condition. It's not a thing that you can just wipe out with a drug or radiation or chemotherapy. You can't just kill it like that because you're killing the body with it. Doesn't that make sense? So, you take this as an example. Here's a perfect example. Anybody here ever had shingles? Woo-wee! That's not fun, is it? A lot of pain. Shingles is a virus, right? And so the thing about a virus is you get it long before you feel it, right? Everybody knows that. Whether it's a herpes sore on your lip or shingles or the chickenpox, whatever it is, when it gets in your body, guess where it goes? Into your nervous system. And it lays there dormant in the nervous ganglia for how long? Many years. Many years. So that's shingles that you didn't get yet. Ooh, it's in there. It's in there. It's playing hooky. But the second you let your guard down, poof, it could get you. And then you're like, oh, I got the shingles. Darn it, I didn't get my vaccine. What, is that what it was? It was because you didn't get the vaccine, you got the shingles? No. The cause wasn't a lack of a vaccine or an antibiotic, right? I love when they give antibiotics for viral infections. Well, that makes a lot of sense. But the reality is that those bacteria and those viruses, they're in you right now. God created those things for a reason also. It's what keeps your body in balance. It keeps our environment in balance. You can't just kill it all. We need that. Most of your gut, most of your immune system depends on good, healthy bacteria in your gut. And antibiotics destroy that. That's why you increase the rate of reinfection when you take antibiotics. So what do you do to correct the cause? You strengthen your immune system. If your immune system is weak, now you've increased your risk for a virus to get you or a bacterial infection. So how important is your nervous system? Did you guys just learn? You just learned something real important there. How important your adjustments are to make sure that a virus doesn't rear its ugly head. How about that? That's worth the price of admission right there. So, one cause for health, and there's one cure for disease. There's one cause for what? Health. And there's one cure for what? Disease. Let's just make it simple. What is health? What is health? 100% normal expression of life. Right? Is a dead person healthy? What does a dead person not have that you and I have? Life. Where does life begin? Conception. Sperm fertilizes an egg. That's the moment that God breathes life into you, Michael, right? The intelligence that created the living universe, that animates the living universe, right? Breathes life into you. That amazing intelligence that hung the stars and the moon now is inside of you and I. It's right now, that intelligence that formed the living universe, that animates the living universe, right? That intelligence is inside of you. It was breathed inside of you the moment that you were created. And it takes hold of those cells and it forms you while you're in your earthly mother's womb. It's so smart. What system does it develop first? Your nervous system. So life is expressed through your nervous system. Did you know that? Your nervous system is the communication system of this life. Now, it's intelligence that resides in the brain. And it runs down the spinal cord and over the nerves. And if you cut the nerves going to your heart right now, what happens to your heart? It stops. Life or death? Yeah. So this is where health comes from. I'm tying this all back to everything that you just learned right now. So there's one cause. And what is that cause? The cause is God Almighty himself, who created life. He is the cause for you being in existence today. And one cause for your body to be intelligently able to heal a broken bone, or heal a cut skin, or cure cancer, heal anything. It's killing cancer right now. You don't even know where you have it, what's going on, where it is. Your body knows where it is. It's already going to work. It intelligently knows how to do all of these things. One cause. The same cause that gave you life, the same source of life that animates the living universe, is the source of where your health comes from. Right? Are you with me right now? And the name of the game is to make sure that nothing interferes with that in your body. So one cause for health. The cells in your body, the tissue cells, right? They send messages to the brain, telling it what it needs. And then the brain sends messages back to the cells, giving it what it demands. So it's the constant feedback loop which life is expressed. That is the source. That is the reason why an individual is healthy. Because there's nothing interfering with the communication between the brain and the body and the body and the brain. Does that make sense? Okay. Now we have this thing called subluxation. Larry, you got it?
Yes.
You got it. It's not a subway station. It's a subluxation. Not an easy word to remember, but sub means below, right? Lux means light. Ation is a condition of, right? Less than 100% light or less than 100% life, because subluxation chokes off life. If life is what's being expressed in your nervous system, and now you've got a bone sitting on a nerve interfering with the expression of life, it's choking off life. And if something's choking off life to your cells, what is it doing to them? It's killing them. So if the cells are now, and you say, where am I getting this from? Tissue cells functioning at 50%. Well, there was a study that was done at the University of Colorado. It found that the weight of a dime on one of those nerves could reduce the nerve supply by 50% in just 3 minutes. The weight of a dime. So most of us, we have subluxation, we don't know it. And we're not functioning at 100%, and you'll never know it until you get diagnosed with a disease. If you've got these cells functioning at 100% in your, let's say in your ear, you got a whole bunch of cells functioning at 50% in your ear. What do you got? A garbage can full of garbage, weak cells that are a ripe host for what? Bacteria. Does that make any sense? What if this is in your lungs? What if the nerves in your neck here are being impinged and you don't feel it, and it's shutting down life to the lungs? Are those tissues nice and strong and resistant and healthy? No, they're weak. They're weak. And they succumb to infection. Because what? We're a ripe host, just like that filthy garbage can. And when you get pneumonia, or when you get a respiratory infection, and you take antibiotics, have you cleaned out the garbage can? No. So what do you have to do? You go to the doctor, and they give you the prescriptions. Now, not only do you have interference on the way down to the cells, now the cells, remember, they're trying to talk to the brain, tell them what it needs. Now you've created chemical interference between the body and the brain. Wow. Turn to your neighbor and say, wow.
Wow.
That is not good. Okay? That's adding insult to injury, isn't it? And so this is our healthcare system, guys. never correcting the cause, the source, and the root. And this is why as you get older, you take more medication. And then you have side effects from those medications. And you never get your health and your body functioning back to 100%. Right? So what do we have to do to correct this? You can't just stop taking the drugs, right? I wouldn't tell you to do that. Let you run around with subluxation, right? And not take the drugs. That's not smart. But if you can correct the subluxation, well, maybe your body will get strong enough to the point where it can start reducing the necessity of taking the medication. I'll give you a perfect example. My dad, he got his first subluxation when he dove into a lake. At the bottom of the lake, there was a cast iron tub. Dove into the lake, boom! Knocked the top bone out of alignment in his neck. He woke up 2 weeks later in an infirmary, and his head was pounding because the top bone in the neck controls the blood pressure. So he leaves the infirmary at 17 years old on 6 different medications, and just like you're seeing here, subluxation, medication. They never found the cause, the bone being out of alignment, because of the impact. So there he goes the rest of his life trying to live normally with his body functioning at a fraction of its normal potential. And because of the medications and because of how poorly he felt, how badly he felt, he started having problems. He couldn't control his anger, couldn't control his weight, he had a thyroid problem, he had a kidney problem, kidney stones, all these issues. Well, fast forward many years later, that started to rear its ugly head. Somebody in pain is not fun to be around. And that was my father. And if there was a day that went by that I didn't hear him screaming at my mom or taking the belt to me and my brother, that was a weird day, you know? But it was because of his pain and his suffering. And I came home from chiropractic school one day, and he was sitting in front of me with a headache, and I adjusted him right there on the spot. Just one adjustment like that. He jumped up out of the chair. He didn't know what hit him. But within a minute, he looked at me and said, "What'd you just do? It feels like somebody flushed the toilet." Wow. All of the pressure left his head. It happened that fast. Now that was almost 40 years ago, and I was just practicing on my dad. I happened to hit the right bone at the right place for the right person. Because as much as I used to hate him back then, that's how much I love him now. A man with no headaches is a lot more lovable than somebody who's in pain all the time. And, you know, if my mom was here, she'd tell you that chiropractic gave her husband back. And my dad will tell you it gave him his life back, but you know what? It gave me the confidence to see what chiropractic could do, not just to get someone out of pain, but also to see how it can transform all the other aspects of their life and their relationships and all the people around them as well. You see? Does that affect your body chemistry? You better believe it. Yeah, you don't think right, you don't sleep well, you don't function well in society under these conditions. Somebody who's dealing with this, some of these kids, some of the criminals, some of the people that are locked up, this is what their chemical composition is a result of. And just think about what one adjustment could do sometimes, like what it did for my father. Think about one adjustment, what it could possibly do to change and transform somebody's life because of the effect that it has on the nervous system, which controls their body chemistry, which controls everything. And if you keep it there long enough and they're able to reduce and get off medication, you know what that is? Freedom, total freedom. Total freedom. That starts now becoming a person that God intended them to be. And that's huge. And so what you're learning right now is where health really comes from, right? Isn't that what you're learning? It's not coming from the outside in, it's only coming from where? The inside out. And this is huge. Because this is what our families need. This is what the world needs. How much different would our community be, would our world be, if people were functioning at their God-given potential? Raise your hand if you want to be functioning at your God-given potential. Yes, but doesn't everybody deserve that? Isn't that everybody's birthright? And here you thought that chiropractic was just good for your neck and your back. Turn to your neighbor and say, "Wow!" Okay. All right, so what causes these subluxations other than diving into a lake and hitting a cast iron tub with your head like my dad? which is very uncommon. What's more common? Being born with C-section or a vaginal birth and being yanked out of the birth canal by your neck. You know, imagine if I grabbed onto one of you guys and started dragging you across the floor by your head. How healthy would that be? Not very, right? But then we sleep in all these bad positions, and you know, we have slips and falls and fender benders and thousands of falls learning to walk as children. It's rare that I ever find somebody that doesn't have subluxation. We live on planet Earth. It's a fact of life. Here's something from a fibromyalgia conference, team of surgeons. They said head and neck posture is a major factor in the fatigue and what? Immune function in patients suffering from fibromyalgia. The arrow is pointing to the brainstem there. You remember Christopher Reeves, the guy who played Superman, 1980, flipped off the horse, broke his neck, and he was paralyzed. But that's not what he died from. What he died from was chronic upper respiratory infections because the bone that broke, the atlas, they couldn't fix that. It stayed jamming into his neck, depressing his immune system. And that's a major part of a strong immune system, making sure that your atlas is checked. Making sure what? Atlas. Everybody knows what their atlas is, right? Dr. Ronald Puro, New York University Cancer Research Center, studied the immune systems of cancer patients, non-cancer patients, and non-cancer patients under chiropractic care for how long? 5 years or longer. The results, the chiropractic patients had immune systems, on average, 300% stronger. Raise your hand if you've been a patient here for 5 or 10 or 15 years and you've noticed that you hardly get sick like you used to, or you don't get sick anywhere near like your friends or your family members do. Okay, so turn around, see the hands. Maybe you've been here for a year, whatever. So maybe you see it too. But if you haven't seen it yet, you have something to look forward to. I promise you that. Dr. Gutman, a medical doctor, Boston University, he studied 1,000 infants with birth trauma, bless you. His study revealed that infants that were adjusted, showed improvement with what? Colic, restlessness, fever, and seizures. They were adjusted. And what he found was abnormal function in their neck because of the birth process, the damage here. It led to a lowered immune system and is a causative factor for what? Ear infections and tonsillitis. This is another reason why my children and many of the children, the moms who bring their kids in here to get adjusted as infants and babies, some of you will see them, like, why are they adjusting babies? What? How could a baby have a neck or a back problem? Hopefully none of you are thinking that, at least at this point. You should understand. This is why I have never had to take my children to the doctor. If it was emergency, you know, we took them to the hospital to get stitched up, yes. But they never had to deal with that because from the moment my kids were born, literally within minutes or hours, I did what? I was adjusting their atlas, yeah. And so that has kept their immune system a lot stronger. And so HIV research, this was a study when I was in school, they published this in 1990. That's when I started chiropractic school. And they did a study where they took a group of patients and they gave them real adjustments, upper cervical on the neck at the atlas. And then they took another group and they gave them sham adjustments on the neck here, but they didn't really adjust them. Here's what the conclusion of the study found. The people who got the real adjustments, they saw their CD4, which is a primary marker of the white blood cell count, increase by how much? 48% compared to those who got the sham adjustments. So it's a real thing. So the study outlining how this happens. Now, that was a study, but when I graduated, one of the first things that I did was I found an AIDS shelter in Fort Lauderdale. And I went down there and I took them a copy of the study and I said, here, this is what the study is showing right now. I'd like to apply that. I'm willing to donate my time. The only thing that I ask is that I would like to see the blood reports every week. You know, their viral loads. I want to document all of this as I take care of them. And what do you think I found as I was taking care of them as the months went by? Same thing. Their CD4 level was coming up. Their viral load went down. And I watched many of them actually get off of their AIDS medications. Wow. Yeah. So, the source, guys, the source. This is where health comes from. You know, one of the easiest things that you can do to stay as healthy as possible for the rest of your life, just make sure you keep getting your spine checked. It's so simple. It's so simple. What should you do the next time you're sick with a cough, a sniffle, a sneeze, or a flu? If you know how profound the effects are from an atlas adjustment, what do you think you should do if you come down with something like that? If you have symptoms, what do you think? What do you think of? What's that first? Get adjusted, or at least come get checked. Your atlas may be clear, but when in doubt, get checked. You know, my wife is fighting something off. She woke up yesterday. She said her neck felt like it was in a vice. She had this splitting pain here. I said, maybe it's something with your sinuses. She came and got adjusted yesterday. And however, she woke up this morning, I'm like, yeah, are you any better? She's like, no. I said, you should come and get adjusted again. She came in, she got a phenomenal adjustment today. Her neck just literally exploded. It was really locked up yesterday. Good adjustment today. I know when she wakes up tomorrow, she's definitely gonna be better. But this is what, you know, this is the best way. Remember I said when we started this tonight, I said how to get the most out of the care that you're receiving, right? It's one thing to have your neck and back feel better, but hey, if your immune system's stronger and you can get sick less often, or you can avoid taking a medication or an antibiotic, or help lower your risk of cancer, what is that worth? What is that worth, right? What's the most important thing you can do to maintain a titanium immune system? Get adjusted. Get adjusted. You know, stay under regular care. That's the title of our workshop tonight, right? Titanium immune system. Titanium. When you think of titanium immune system, you should be thinking one word: Atlas. Atlas. That's all you should be thinking about right there. So here's a picture of my family. That's my brother and his wife far left. They have 3 little kids. My side of the family on this side, and there's all 10 of us there. We were in the jacuzzi one of the holidays. Our kids are a little bit older now, but I love that picture because we all have the same thing in common. Application of everything that you've learned tonight. The kids were adjusted within minutes of birth, and same thing. We applied 100% how to raise a drug-free family. You're looking at it right there. And so here's a study, not just for young families, but here's a study for 311 chiropractic patients 65 and older who received maintenance care for how long?
5 years.
5 years or longer versus healthy citizens the same age. Chiropractic wellness patients had 60% fewer hospital admissions, 62% less surgeries, 85% less pharmaceutical costs. So again, if you haven't been here for 5 years yet, this is the direction you're moving in, right? The longer you're under chiropractic care, the bigger the return on your investment. I don't know if I'm going to get audio here. Every time I've done a video, I haven't.
Yeah. So Ricardo Markland, you're giving me an amazing praise report. How long have you been a patient here now?
Since July of 2008.
And what did you originally come in for?
I came in because I was having problems with my blood pressure.
And what were the results after care?
After care, the blood pressure has normalized.
Excellent. Were you on medication?
Yes, I was.
Are you on medication now?
No, I'm not.
Excellent, excellent. And what other benefits have you noticed since you've been under care?
I have not been sick legitimately since 2008, since I've started the care in this office. Outside of a few sniffles that are co-occurring, I've not been sick.
I mean, before, is it something that was very common? Were you getting colds and sicknesses? Because as a teacher, you're around that a lot, especially with kids.
Yes, and then in the winter months, it gets cooler, I would get sniffles. And I've not had that. As a matter of fact, I was in New York in the snow and I left it was warm. I came back, not a problem whatsoever.
That's great. That's a sign of a healthy immune system and a healthy future.
Yes.
Keep up the good work, my friend.
Thank you.
Thank you.
So he said July. He said it in 2008. That's when he started. That video is a little older. He did get his first cold a few months ago. First cold in 17 years. Still a pretty good track record. Probably better than mine. But yeah, so I just wanted to share that with you. Okay, so just you guys know this because I mean the technology that we use to actually evaluate the spine to see where what things look like if you have subluxation, where your spine is affected, regardless of how you're feeling. We use thermography. You see the scan on the left versus a healthy one on the right. So if you're here right now and you're not currently under my care, if you have any of those symptoms, the fatigue, tiredness, sinus trouble, allergies, pain, whatever it is, if you have those, the scanning technology can allow us to pinpoint where it may be coming from. And even if you don't have any symptoms, the best time to, like when you go to a dentist, if you go once a year, even if your teeth aren't hurting, what do they do? An exam, right? They still do an exam because prevention is far more important than treating the effect once it's there. So prevention, from a standpoint of looking at your nervous system to see if there's any issues before they rear their ugly head, is invaluable. And so we use the scans. If we see something come up on the scans, then we'll usually take x-rays to corroborate the two. We look and we put it all together. And if you're not under my care and you're a guest here tonight, and you'd like to have that done, what we normally do is a friends or a family certificate. You can leave with one of these. Your first evaluation includes the consultation, the exam, the x-rays, the report of findings. Normally that's over $500 for that first, those 2 visits, but with this it's only $97. So it's an amazing gift that you're welcome to take with you on behalf of the loving person who invited you here with them tonight. But if you would like to do that, please don't leave without seeing Tamara or Deborah up front, and they'll do that for you before you leave. They will give that to you and show you how that works. Okay, so I want to just take a moment to, let me see, what are we doing here? Yes, we have an award. I want to recognize somebody who has been a faithful attendee to our workshop. So we have something here called our Elevation Health University Core 4 degree. This is for somebody who's been here for 6 or more workshops. This is going to Veronica Johnson. Congratulations. Wonderful, wonderful. All right, I'm going to have everyone stand up for just a moment, just to take a quick break. We're not done yet. We just got a few short minutes. I want everybody to stand up, turn to the right for me, put your hands on the shoulders of the person to your right, and you're just going to do a massage. Just do a massage and go ahead. Do a massage, get some of the stress out, wake them up. We don't want anybody falling asleep. All right, karate chop. Get that blood going. Good, good. All right, turn around and love your other neighbor. All right. So do a massage. Love your neighbor, don't hurt them. All right, karate chop. Good. All right, we only have 5 or 10 minutes left, so just have a seat, and we're going to finish right now. Have a seat, have a seat. Yeah. Okay. So let's finish up. Let's bring this all in for a landing here. All right, so we said consistent chiropractic care. Number 2 is consistent sleep schedule. All right? Consistent sleep will keep your immune system primed and at its highest levels, all right? When you sleep, you need what? Cave-like darkness, yeah. How much sleep should you be shooting for every night? 7 to 8 hours, and it needs to be consistent, yep. All right, what about exercise? What does that do for your immune system? What kind of exercise is the best exercise? Walking is good. Walking is walk. Okay, so walking is good. Resistance training. Studies are coming out now showing as far as anti-aging, preventing dementia, Alzheimer's, preventing falls, fractures, which is the #1 cause of death in the elderly. Nothing more important than strength training. So my recommendation is to kind of break it up, do a couple of days of brisk walking, and do a few days of strength training. And so we would be remiss if we didn't bring this into our discussion tonight, because it's important for a lot more than just your immune system. For all the aspects of all the things that people are being treated for today with diabetes, heart disease, Alzheimer's disease, cancer, exercise plays a crucial role, because you start turning your body into an inhospitable environment for disease to develop. If you're consistent with it. What's the operative word? Consistent, yes. All right, also consistent low glucose levels. When your glucose levels are high, you are feeding cancer. When your glucose levels are high, you're weakening your immune system. You're opening up the channels to feed sickness and disease in those cells. And so, we have to look at this and evaluate on an individual basis because everybody's different. Many of you guys are familiar with this concept. You've been losing weight. You're trying to keep your blood sugar down. You're working on it. And again, you come back to the workshops so that every time you come back, you can check the box and you can be like, right, Beatrice? I'm doing that. Right, Denise? Got that? Right? Luther? On it. So that's why you keep coming back, because right now you're drinking out of a fire hose. You can't do it all, can you? No. And so little by little, you start looking at your labels. You start looking at what's in your pantry. You start honestly evaluating the choices that you make after you go out for dinner. Do you have dessert every time after you go out for dinner? Seriously. If it's a routine that you have to have sugar after every meal, you got to ask yourself, can you do better? So, we know this. Whatever you're seeing here, we know. But when you look at that picture, that would seem less assuming. Wow, that could actually be healthy in some ways. Well, for somebody who has a weak immune system, high risk for cancer, your A1C is off the chart, I'd say you need to stay away from most of that and try to gravitate toward what's better known as a paleo kind of diet. Where you get your sugars from green leafy vegetables, low sugar fruits, and then you got your fats and your proteins. And you got all the fuel that you need. You'll never be at a loss for energy eating like this. Did you know that? When I ran the Disney Marathon, I ran it on fats. I didn't have a high carbohydrate diet. I had water-soaked almonds, salmon, and things like that. The fats will give you far more energy for fuel than from these carbohydrates. So just understand that this is closely tied with the strength of your immune system. Number 5, consistent supplement support. From the beginning of the century to even into this century, the last 100, 120 years, what's happened to the soil? Mineral depletion. Yeah. So the same banana that you would have ate 100 years ago, not the same banana today. You're getting fruits and vegetables, and they look green and beautiful, and they've been genetically modified a lot of the time, and we're not getting the same nutritional content, the vitamins that we think that we're getting from all these things. It's just not there. So that's why I say it's not a recommendation anymore, supplements. It's an absolute requirement if you're serious about preventing sickness and disease, if you're serious about your health, you need to plug the leaky holes. And it's an investment that pays dividends. So one of the easiest, all-in-one multivitamins that kills so many birds with one stone is this Complete Clean. I talk about it at a lot of these workshops so that you can kind of make things simple and also cost-effective. So with the rising cost of food and things like this, when you take this and you have 26 grams of protein and you have your sugar, you got your fats, you got your antioxidants, you got your nutrients. It's almost like a meal replacement, really. And you can put coconut milk and almond milk. You can make a smoothie out of it. There's so many different things. But when you look at the nutritional profile, you can see that it's got 8 grams of fat, 240 calories, only 6 grams of sugar. And then here's your protein, 26 grams of protein, so it's super rich in protein. That's why I take it right after my workout. You got your vitamin A for your immune system. You got your vitamin C, your B vitamins. You got your zinc for your immune system. You got your quercetin, antioxidant, turmeric extract, which is an anti-inflammatory. It kills cancer stem cells. It's N-acetylcysteine, which is the precursor for glutathione, which is the master antioxidant in your body, which is what's helping your body to detoxify. So it's a low-level detoxification system in this as well. And then green tea, which is for your metabolism. It helps with your blood sugar. It helps with fat burning. So bang for the buck. It's really hard to beat this. If you haven't tried it, I would strongly recommend it. We have it in vanilla and chocolate. The probiotics is another foundational staple that should be a one a day for everybody in this room. So in the last workshop, we talked about your gut. 80% of your immune system resides in your gut. And if you're taking one of these every day, you're making sure that you have a good foundation to keep a healthy gut, and reduces your risk of colds, flus, and cancer because of that. Enhances your body's absorption of nutrients, because where does digestion occur? in the gut. If you don't have that good bacteria there, if the surface of your gut is inflamed because you don't have the good bacteria and you don't have a good healthy microbiome, you're not absorbing the nutrients. That's nutrient deficiency, and what does that translate to in terms of your immune system? Weakening, right? And then, of course, bowel movement regularity, which is important. So in your handout, you got this. It kind of lists out all these things. The only thing I didn't go into was zinc. You know how important zinc is for your immune system. And then vitamin D. We always check your vitamin D because that's a critical marker for your immune system. Where should your vitamin D be? It should be somewhere around what? 70. Very good. All right. So, and also it's for cognitive function, heart health. So, you should be, these are the ones that fit the bill for tonight. You know that the workshops, when you're here, this is the only time we ever discount. So it's 15% off for tonight only. Based on whatever we have here, the quantities are limited. Obviously, it's a limited supply. So just see them on the way out before you go. Did you learn some important things tonight conceptually? Yes. Was it empowering? Was it encouraging? Who else needs to learn what you learned tonight? Everybody, right? Yeah. Will you share with people what you learned? People are hurting, they're sick, they're suffering. You just never know. They're hanging by a thread. You just never know. And it doesn't cost you anything just to say something, share it with them. And they may not understand what chiropractic is per se, but we didn't really talk about chiropractic so much. We talked about where health comes from, right? Where does it come from? Not from the outside in, where everybody's looking, right? It comes from where? The inside out. The cause of being healthy is in your nervous system. And the cure is from removing anything that would interfere with it. So simple, isn't it? So simple. One of the easiest ways that you can connect somebody with them is bring them to a workshop. Bring them next month. You can invite them anytime here. You can get them a health pass. There's so many different ways. But please just make application with what you've learned tonight. Guests, again, if you're here, you're not a patient of mine, you want me to get you checked, your spine, your nervous system, on the way out, please make sure that you get your friends and family health pass as our gift to you. And then also, we talked about the nutritional supplements. The immune boosting supplements are yours if you can get them before you go. And that's all we got for tonight. So thank you so much for joining us. Love and appreciate you guys. God bless.